Bismillahirrahmanirrahim. The concept of site-specific regeneration, specifically for heart, is discussed in this video. These are the references for the video. Traditionally, it has been considered that the cardiac myocytes or heart muscle cells are permanent, non-dividing, and terminally differentiated cells, and they are incapable of regeneration. But now there is new evidence that the cardiomyocytes can regenerate at very slow rate to maintain the homeostasis and minimal turnover of the cells. However, this rate is insufficient for the meaningful repair after large injury, as happens in myocardial infarction, and possible sources of these regenerating cells may be resident cardiac progenitor cells, uh, but their existence and role is still uncertain. Then there is possible contribution by bone marrow derived cells and unknown or other systemic sources. So the response of the myocardial cells to the injury is by granulation tissue formation. There is inflammatory phase that is followed by infiltration by the fibroblast, and then there is scar formation that replaces lost myocyte with fibrous connective tissue. This leads to permanent loss of contractile element, and the fibrous tissue also reduces the contractility of the surrounding viable myocardium due to stiffness. So, despite the presence of some regenerative potential, healing in the heart occurs predominantly by scarring after ischemic or infarct injury. So, these illustrations are exhibiting this concept. This is the normal myocardium. These are the normal myocardial cells, and they are permanent cell, predominantly permanent cells. When there is injury to these myocytes, cardiac myocytes, what happens? There is infiltration by the inflammatory cells, and there is onset of fibrosis after the necrosis, and finally a fibrous scar is formed. Here you can see the myocytes have been replaced by the fibrous tissue with some interspersed fibroblasts. This is the histopathological section of the heart that is stained with hematoxylin and eosin, showing myocardial infarction with the coagulative necrosis. The key features over here you can see that these are the cardiac myocytes. Normal myocardium, these are intact with their typical eosinophilic cytoplasm and elongated wavy fibers. The muscle fibers are organized and they are closely packed, while over here in this area, this is the area of coagulative necrosis. Here, the myocytes have lost their normal structure and are fragmented. Uh, the cytoplasmic and nuclear detail is lost in this area. There is infiltration by the inflammatory cells, mostly neutrophils that are shown by purple dots. This is indicating an acute inflammatory response. Uh, Edema and hemorrhage can also be seen in this area. These are loose areas, edematous areas, and there are scattered red blood cells that can be seen in between. There is a transition zone also, that is sharp boundary between viable uh, myocardium and the necrotic zone that is typically present in the early stages of infarction. So this is a classical microscopic appearance of early myocardial infarction, usually seen within first few days after ischemic injury. Over time, this necrotic tissue that is present over here, it is cleared and replaced by granulation tissue, and finally a fibrous scar is formed. This is the histopathological appearance of the heart. This is Mason's trichrome stain, and it is showing healed myocardial infarction in the chronic stage with extensive fibrosis. Here you can see that this red area, this is showing the disrupted myocardium, and the this disrupted viable myocardium, they are organized, elongated, wavy appearance, and typical of normal myocardium. And these blue areas, all of these blue areas, they are areas of fibrosis. And this is a dense collagenous scar or dense collagen deposition, indicating replacement by fibrosis or scar tissue following the infarction. The blue color is typical of Mason's trichrome stain, which highlight the collagen fiber. This dense fibrotic tissue replaces the necrotic myocardium that was lost after the infarction. So, small blood vessels and capillaries can also be, these red areas, small blood vessels or capillaries are scattered within this fibrous area, indicating the granulation tissue that is going to be matured into scar formation. So this infarcted area has undergone full organization, and the myocytes that are died during ischemia were replaced by collagen or scar tissue, which provide structural integrity but no contractile function. The fibrotic replacement of these myocytes impairs the overall contractility and compliance of the heart. Thank you for watching this video. If you have any question, please write in the comment box.